I had several patients who told me I was extremely nervous about coming in for their recalls today. So patient anxiety is a real thing. And I think many of us have perhaps seen an increase in the patient anxiety because of the past, year, things that, patients have just been home thinking about, worrying about things. They have more time on their hands. So patient anxiety is really something that we need to consider. And anything we can do to minimize that certainly is a benefit for the patient. Reducing those recalls that maybe, if we can quickly tell that it is a scar and not really an area of distortion, is going to benefit the patient. Because if we have to recall that patient, certainly none of us want to, radiate a patient unnecessarily, because that's, certainly not a benefit to the patient. And again, the expense. It really, some of our patients are on fixed income. We don't want to have them incur costs that are unnecessary because maybe we didn't mark their scar and then they come back and we find out it's really a scar. We have to appreciate that. And, I certainly work in certain communities that, again, are more affluent and some that are not. And so we need to appreciate how that impacts our patients. And, I've had patients who have said, I couldn't afford to come back for my additional views because of the cost. And that's, certainly not what we want to hear. Also, the inconvenience. Patients may have others that they're taking care of, whether they have children, whether they have elderly parents that they're caring for, and just the inconvenience of having to say, miss their work. We don't want that to be the case for our patients if we can minimize it.